You are listening to the Aging Options podcast with elder law attorney Rajiv Nagaich. As the best-selling author of Your Retirement, Dream or Disaster, and host of 2 hit public television specials, Rajiv Nagaich has emerged as a retirement planning thought leader known for his willingness to disrupt the status quo. In this weekly podcast, Rajiv Nagaich offers piercing insights about the hidden traps in traditional retirement planning advice, along with straight talk about the problems during retirement that money, investments, estate plans, and insurance products don't address. If your retirement plan has been all about saving money, creating an estate plan, and buying long-term care insurance, what Rajiv Nagaich says may surprise you.
Welcome to Aging Options, the podcast. Today you're going to hear a question from a caller of mine not that long ago about an issue I bet majority of us have heard something about, but totally don't understand that. Here's the call.
Good morning. I'm 81. My husband's 87. He has been in the hospital off and on and in rehab rooms since October the 26th. And now they're saying he's over the 90 days. He has to go into a rehab place or stay at the hospital. What I'm inquiring and trying to find out through social workers is, what do I do now? I have to make a decision by Monday, and would it be wise to go ahead and get a long-term care thing for him and I now at our age? I just need some answers. I'm completely perplexed.
There you go. So you end up in the hospital, you got Medicare, you got a supplement insurance plan. The proper way to plan around the healthcare issues was just that, Medicare and supplement. But did you know the limits and the gaps in the plan? Most people don't. Medicare will actually take care of you for up to 90 days in the hospital, right? For the 3 months you're there, well, they'll cover the first 90 days. And beyond 90 days, you're on your own. Well, you have a lifetime reserve of another 60 days of care in the hospital. You can use it up one time. So really one episode can go up to a maximum of 150 days. But then beyond that, you would have to pay privately. And can you imagine paying privately out of pocket? So in the caller, the caller is really talking about, well, my husband's in the hospital right now, and we have to get him out to some rehab center. Will that be impacted by the 90-day rule or the 150-day rule? And the answer is no. Interestingly, if you end up going to the hospital, you spend 3 midnights there. Clearly, if we are running out of 90 days, we spent more than 3 midnights. And you still need some measure of skilled care. Could be some measure of OT, PT, speech therapy, because your situation is with this type of therapy, you could actually improve and get better, or at least you could maintain your status quo and not go further declining. Then Medicare says you can go to a rehab center and we will cover you for up to 100 days. If you have traditional Medicare, and if you have a Medicare Advantage plan, then depending on which plan, there'll be a certain limit there also. So think about the conundrum we are in. We never thought that we'd be dealing with these bad issues in retirement. Think about what retirement planning was. At the planning stages, we were thinking, I need to have a house, or we need to pay off our house before we retire. We need to accumulate as much money as we can. Surely between Social Security and Medicare and our debt-free lifestyle, we'll be okay. It will be okay to do what? Do fun things, naturally. Travel and spend time with friends and family and pick up hobbies and all that. All the things that we know we would like to do. Nobody is really thinking about that we will fall ill, end up in a nursing home for 90 days or longer, and then the hospital will say, sorry, either you're going to pay privately, you got to get off. Or maybe you go to the hospital, and then from there you go to a rehab center, but you got a situation where you are not getting better as quickly as possible, and the Medicare social worker or the nursing home social worker comes and says to you that, Medicare is going to not continue to pay for you because you're not making progress. And if you want to stay here, you can be our guest at the rate of about $400 a day. Ouch. So what are the rules behind this? Let's really look at this from a different perspective. These are issues that are going to plague a lot of us. 75% of people over the age of 65 and about 85% of people over the age of 85 will deal with some time in their life when they're no longer able to manage their own affairs. You're going to need somebody else to help you with their day-to-day affairs. For that, you'll be looking at your healthcare system, which is Medicare and the supplement plan. And for some of you, you'll have to have a backup system that if Medicare shuts off, then what is our option? So the first thing that you do is to pick Medicare carefully. You will have a choice between traditional Medicare and Medicare Advantage. Traditional Medicare is much more predictable. You will have up to the 100 days if you have traditional Medicare. If you go into Medicare Advantage, it's a crapshoot. Every policy, every plan has got its own rules. And that's what makes Medicare Advantage so difficult to work with. But regardless, you've got either traditional Medicare, Medicare Advantage, your own reasons. On a different podcast, we talk about this. What is the right way to pick the Medicare supplement plan, Advantage or traditional? What is the difference? So you need to make yourself aware of that. Regardless, you've got Medicare. What else do you need to know? What you need to understand, when Medicare gets to a point it stops paying things, then our system, Medicaid, will cover the things that Medicare used to cover at one time, is not going to cover them anymore. Medicaid is a safety net program in our society, and it's not available to everyone. Medicare, if you have worked at least 40 quarters or 10 years back to back, and you put into the system, then Medicare is an entitlement. You're just going to get it. There's no requirement. How much money you have, what your health is, how old you are, doesn't matter. You put into the system, you're entitled to this benefit. Medicaid, on the other hand, is a means-tested program. It's only available to those who have less than $2,000 to their name. So in this particular caller's case, where the husband is in the hospital, the 90 days are running out. Maybe she should be asking for the 60 days. Let's say even the 60 days have now run out and she now is going to go to the rehab center. You can get, first of all, Medicare would cover some number of days. Let's say now that is also exhausted. Now you can look to Medicaid to cover the long-term care portion of the bill, and Medicare would still be available to cover the skilled care of the needs. It'll require your doctor writing a letter to get Medicare to continue making the payment when somebody goes on Medicaid. So let's talk about Medicaid for a second. In this case, clearly there's a married couple. There's a husband who's in the hospital system about to go to a rehab center, and there's the wife. Here's how Medicaid will work. For husband to get his care covered on Medicaid, he can only have $2,000 to his name. But because he is married and has a spouse, he has the easy answer to transfer everything out of his name and put it in his wife's name. He can only have $2,000. But the spouse can have one house of any value. She can have a car of any value, a sundry amount of other cash assets, depends somewhere between $70,000 to $155,000. And the spouse can have an unlimited amount of income. And if you go to a good elder law attorney, not an estate planning attorney, but to a good elder law attorney, they'll know these rules intuitively and they'll be able to rejigger the estate, get everything out of husband's name, put it in wife's name, make sure the wife has a house, a car, whatever the cash they're allowed to have, and an unlimited income. That means all the money will come back in the name of the wife and the husband can go on Medicaid. That's not going to be a problem. After the husband goes on Medicaid, there's a difference now. Medicaid will cover long-term care needs to get you out of bed, get you into the shower, get you to do the things that you can't do yourself, which is not skilled care. Skilled care is still covered by Medicare if a doctor is willing to write an order that you need to give this person skilled coverage, without which this person's condition is going to decline. As long as the doctor is willing to say that giving the skilled coverage will maintain his status quo and prevent further decline, or at least give a hope of this person getting improvement, then Medicare has to keep paying. Now, in the practical world, I'll tell you though, Medicare probably is going to go ahead and reject the claim when they first get it, and you have to stay on the claim, and they eventually 90% of these claims get approved after 2 or 3 denials, but you just have to go through the denial process. So this is just an example of when people, even people who have done a lot of good planning in their lifetime, they've saved money, they've invested money, they've got legal documents, they've got their right insurance policy, they've got a doctor, even despite all those efforts. This is one area, which is long-term care, that we are so ill-prepared for. And if you look back at this, I think, when I am working with my clients, and what I'd be saying to you is that hope to God these things never happen to you. But plan as if for sure you're going to deal with this type of an issue. If you have a plan that you will deal with this type of an issue, you will start looking at other resources you need to bear on the problem. And you will have a plan that will say something to the effect that, wife of mine, I love you, I trust you, I never want to be a burden to you. I'll be grateful to be with you as long as I am on earth and then beyond that, in all eternity. But in the meantime, the day that I fall ill, I want you to call this care manager or nurse. I go to the hospital, they know the rules about the whole thing. They'll help pull everything together, and they will help you try and bring me back if that's possible. If coming back is not possible, they have knowledge of the marketplace where they will know which is the right rehab center, which is the right retirement community, which is the right care community. How would you know any of this stuff when you don't bounce in and out of? And what happens if you do all this elaborate planning and you never have to deal with long-term care? Well, guess what? Your family would just had a much better plan. But what happens when you don't plan around these issues and then you have to confront them? Total mayhem. What do you want? The peace of mind and knowledge of knowing that the worst could happen to you in your life, but you're still going to be okay dealing with that issue. And if you didn't have to deal with the issue, your family is no worse off. Or do you want to deal with the situation that, we'll deal with that when it comes there? Now you're talking about the lady on the phone call. You don't need to be that. Thank you for watching. Keep listening to the episodes that I bring, because the issues that I bring are the issues that define failure in retirement. And you want success, not failure in retirement. We'll talk to you again.
Hello, producer Alec here. Thank you for tuning into this episode of Aging Options, the podcast. If you would like to know more about this topic and many other topics surrounding retirement, aging, and how to ensure that you're able to live out the retirement you deserve, please head on over to AgingOptions.com. If you want a comprehensive, deep dive into planning your retirement and don't want to wait until next week's podcast, I highly recommend Rajiv's best-selling book, Your Retirement, Dream or Disaster. You can find both soft and hardcover editions on the AgingOptions.com website. Please follow us on social media at Aging Options. If you want to see this podcast in video form, you can find us on YouTube, also at Aging Options. Until next week, age on.